Hi, Dr. Sullivan. So right now we're doing a number of clinical trials, and one of the trials we're doing is something called Prurigo Nodularis. And I will tell you, it's a condition that people have and they don't know they have it. They don't even know the name for it. And what's exciting is it's a really debilitating condition. It really affects people's lives. It disrupts their lives. And so the fact that they're doing research is amazing. But I want to talk to a patient who has Prurigo Nodularis, and I kind of want to get her take on it. So, hi, thanks for talking to me.
How are you?
So my first question is, did you know that you had Prurigo Nodularis? Did you have the name for it?
No, I didn't initially have the name.
What did you think you had?
I hadn't the vaguest idea. I had psoriasis, which didn't really look like it, but I couldn't find a name for anything.
So Dr. Google didn't help you on this one?
No, not really.
Yeah.
No, because I guess I didn't know what to put in besides a rash on my skin.
And had you seen other doctors before for this problem?
I saw 2 dermatologists, one of which told me just stop scratching, which didn't really help a lot. One told me to go see someone for my head for medication to stop the stress or the anxiety that she thought was causing it.
So this is super common for people with Prurigo Nodularis. So 2 things that I hear all the time is stop scratching, and then the other thing is that it's all in your head. I will tell you that anxiety makes any sort of itch you have worse. So I think that if you are having a problem with itching, if you have an anxiety, you want to help that, fix that, because it'll make it better. But seeing a shrink and stop scratching are just not tools that work, right? So there's actually an internationally known itch expert who tells patients he never tells them to stop scratching, because I think we've all had that experience. When you have that itch, it is impossible to stop scratching, especially if you're half asleep, something like that. And we know that Prurigo Nodularis has a real biologic basis. So if we do biopsies in the area where you have a prurigo nodule, you have increased nerve fibers. So you're super itchy. And that's kind of what's exciting about this study. And you had, I'm sure, tried a number of topical steroids.
Yes, they
right?
gave me all sorts of creams.
And they help a little bit, or
No,
not
it was
at all?
just provisional. It wasn't really too much. It was more of a hassle.
Okay, all right. And what did your family tell you about the
Mom.
scratching? I already got a hint when you were saying something about your mom.
Mom
earlier.
says to stop scratching.
Yeah, the problem is that just doesn't work. You really need treatment. So you came to us to consider a clinical trial.
Yes.
What were some of the worries that you had about maybe doing a clinical trial?
I really didn't have a lot of worries for the clinical trial, especially that I saw that it was a phase 3.
Okay, all right. So we at some point we'll go through different phases, but phase 3 is kind of the last phase before something gets approved, which means there's been earlier phases where they look at how well the medicine works, they look at the safety and everything like that. So you're exactly right. A phase 3 trial, there's more knowledge behind the medication. What were some other things that you thought about?
I had to find convenience.
Okay.
And I wanted to get rid of this thing that I just didn't know how to get rid of.
Okay.
No matter what I did. And so far, it's been
Yeah,
good.
you've been doing pretty good. So I would show you pictures of what Prurigo Nodularis looks like with her, but she's doing so great, so we don't have some great videos for that. What has been the thing that surprised you most about a clinical trial?
It's actually convenient. Some people are scared of the clinical trials, but they shouldn't be.
Yeah, they're highly regulated. So the FDA monitors us. We're monitored by the sponsor who's doing the trial. But it is a trial. It is an investigational med, so we're trying to learn new things about it. So one thing is when you come for the initial visit, we go through something which is called an informed consent. And that lists all the potential benefits and all the potential risks that we know of. It also outlines study visits, compensation, everything like that. Well, thank you for letting me talk to you today.
No problem. Thank you. It's a pleasure.